Aloha, and welcome to the monthly public presentation of the Vegetarian Society of Hawaii. Since 1990, the Vegetarian Society of Hawaii has been following our mission of promoting human health, animal rights, and protection of the environment by means of vegetarian education, as we've grown to become one of the largest all-volunteer, non-profit vegetarian societies in the nation. It's now time to introduce our special guest. We're delighted to have with us tonight our own Grace Chen, MD. Yay. Grace Chen, MD, is a board-certified emergency physician with a special interest in lifestyle medicine. After observing many preventable chronic diseases in the emergency room, she was inspired to create a website, 365 Days of Graceful Living, at graceinhawaii.com, dedicated to educating people about how chronic diseases can be prevented through lifestyle changes. She films her YouTube videos in the beautiful outdoor environment of Hawaii. In her free time, she enjoys experimenting with new recipes, tending to her garden, swimming in the ocean, and scaling mountains. She loves the serenity of practicing yoga, and also she now serves as a member of the board of the Vegetarian Society of Hawaii, and we're so glad to have her. Yay. Her presentation tonight is entitled Miracles of a Plant-Based Diet. Please join me in welcoming Dr. Grace Chen.
Thank you everyone for coming tonight. So I titled my talk Miracles of a Plant-Based Diet. And that's because I think that there's a lot of things people don't know that a plant-based diet can treat. And there's a lot of preventable diseases, like, Lorraine was saying, I started my website because I saw a lot of people coming into the emergency room for things that could be easily treated with dietary changes. Last year, I talked about some of the big diseases, such as heart disease, stroke, and the risk factors for these diseases, such as high blood pressure, high cholesterol, and also some of the diseases of the colon. This year, I'm going to sort of do a little bit review of that, and then also talk about some other diseases, autoimmune diseases specifically. So, a little bit about me. This is my website that Lorraine was talking about. I've always enjoyed filming videos, doing photography, and so that's how I came up with the idea to start a YouTube channel. And I also enjoy writing and reading, and so that's why I started my blog. I thought that I wanted to communicate with people in a way that they could understand it and make it easy for people to learn things. And I think YouTube is an easy way for people to learn things, and videos are very fun to watch, so that's why I started the video channel. I became vegetarian after I read this book, Diet for a New America. Has anyone read the book? Yeah? So I read this a long time ago when I was 16 years old. It was when a lot of my friends had decided to become vegetarian. We all read the book and we became vegetarian together. So it was very easy because all my friends were doing it. And that's how it is when you're in high school. So at the time, we didn't really know as much as we do today about the benefits of a plant-based diet. So a lot of people were telling me, that I might have trouble, with being malnourished because I wasn't getting enough protein, and it was actually incorrect information, a lot of it, but because I didn't know that much myself, I was tending to believe what they said, unfortunately. And so at that time, I didn't make the complete transition to become vegan. So it's kind of ironic because I don't know if anyone's read this book, Proteinaholic. No? This book is really good, actually. He's really funny, and this doctor, his name is Dr. Garth Davis. He is a gastric bypass surgeon. Do y'all know what gastric bypass is? Yeah. So gastric bypass is sort of in my opinion, a radical procedure for people who want to lose weight. They get their stomach sort of stapled so it's smaller so they can't eat as much. And after they get this surgery, they have a lot of nutritional deficits sometimes because part of their stomach is missing, so they can't absorb food as well. So before he does this surgery, he recommends his patients actually try going plant-based to see if that helps. Because he originally used to be an omnivore like everybody else in the United States. He was on the standard American diet. But he changed because he was starting to develop health problems, starting to gain weight, and that wasn't a very good image for somebody whose specialty is weight loss. So he did a lot of research, and he discovered that the vegan diet is really optimal for health. So he decided to become vegan himself, and he wrote this book. But he said that when he checks the nutritional labs of people who eat meat, they actually have a lot of deficiencies too, that they don't realize they have deficiencies in vitamin D, folate, thiamine, vitamin A, and B12. And a lot of it is because they don't eat a lot of plants when you eat a lot of meat, because the more meat you eat, the more full you feel from meat, and you don't eat as many plants. So actually, they have a lot of nutritional deficiencies. So, the irony is that they're telling vegetarians that we're malnourished, but they have nutritional deficiencies themselves. Now, he doesn't really have that much information about vegetarian patients because not a lot of vegetarians go to the weight loss programs, so that's just the way it is. So this is the book, China Study. I'm sure some of you have read this. Yeah. This is a book that convinced me to become vegan. So a few years ago, I was living in Southern California, and the Adventist church there was offering some free cooking classes that were vegan. And I was vegetarian at the time, but I wasn't drinking any milk or eating a lot of dairy because I was already aware that I was lactose intolerant myself. But I went to these cooking classes, and they had this book available, the China Study, and I'd heard about it, and when I read Diet for a New America, they did mention it, so I decided to pick it up and read it. And after reading this book, I decided that there were so many health benefits to being vegan that I was really depriving myself of these health benefits. And given that I have a family history of cancer, I couldn't see any reason anymore to eat dairy products, because, actually living in Southern California, it's like heaven on earth for vegans, There's so many different restaurants, there's so many things available, and there's so many vegans. So that's when I became vegan. So unfortunately, this is the state of many people in America. They hardly get any vegetables. They're eating mostly a standard American diet, which consists of, protein or meat at every meal, and they eat very little vegetables. Most people, a lot of my patients, I ask them, do you get 4 to 6 servings of vegetables daily? And a lot of them can't say they do. And unfortunately, this leads to something called metabolic syndrome. So this is metabolic syndrome. It's usually people who have a large waistline, they have central obesity, kind of an apple shape. They're at risk for these diseases that are kind of diseases of eating a lot of animal products, such as high blood pressure, high cholesterol, and insulin resistance or diabetes. So high triglycerides are a type of cholesterol, and low HDL cholesterol, that's a type of cholesterol, but that's the good kind of cholesterol that gets rid of the bad kind of cholesterol that clogs your arteries. So you actually want to have high HDL cholesterol. So having low HDL cholesterol is not good. This is a review article about the metabolic syndrome. And in this article, the authors state that there's been a lot of evidence and studies showing that saturated fat specifically significantly worsens insulin resistance. Saturated fat is found mainly in animal products. There's very few plant products that have saturated fat, just like a few nuts, and then coconuts have saturated fat. But when you're on a plant-based diet, you're not mostly eating nuts and coconuts usually. You eat plants and vegetables and beans, so you're usually okay. But when you're eating a lot of animal products, then you may be eating mostly saturated fat in your diet. So insulin resistance is a link underlying these different metabolic abnormalities in metabolic syndrome. So they're saying that a consumption of high fat, saturated fat in diets deteriorates this insulin sensitivity, especially when the fat is located in the abdominal regions, like we said, the metabolic syndrome, the apple shape. So to prevent metabolic syndrome, they recommend reducing dietary saturated fat. So this would be reducing your intake of animal products. Now there is some fat in some vegetable products such as avocados and nuts, but in avocados it's mainly unsaturated fat, and they found that unsaturated fat actually is not as harmful as the saturated fat is. So this is a slide depicting how fat works as a hormone factory inside your body, wreaking a lot of havoc on the different organs of your body. Okay, so in the case of angiotensin, it brings up angiotensin, causing high blood pressure. And also, it brings up leptin, which I'm going to talk about on the next slide, and how having too much leptin can cause you to overeat and cause you to get type 2 diabetes. Also, you can have clots in the arteries from these hormones, narrowing of the arteries, and inflammation. So this is slide, sorry, it's sort of complicated, but I'm going to summarize it for you. This fat in your body has multiple effects on different organs, like I was saying. In the brain, the hypothalamus responds to hormones released by fat, including leptin. Leptin, which signals when to slow down to your food intake and burn more energy. But when there's too much leptin, like in the case when you have a lot of fat in your body, its messages aren't heard, unfortunately. So then you overeat, and overeating causes more fat in the body because you're eating too much and you can't burn it. And then this causes diabetes eventually because you have too much fat. And then in the heart and the veins and arteries of your body, this fat surplus floods the bloodstream, causes a lot of inflammatory factors to be released, and it increases your risk of high blood pressure and clots in the arteries. And it can also lead to cancer eventually, they're saying. In the pancreas, this fat leads to increased amounts of insulin to be released. And this is how insulin resistance develops. You have so much insulin that's released, and eventually you get insulin resistance and diabetes. In the liver, the fat is stored as well, and eventually if you let it go long enough, you can get liver cirrhosis from this. And I'm going to talk about this on a future time. So now I'm going to talk about my experience working at the Dean Ornish Program for reversing heart disease in the downtown Restaurant Row area. So I was very lucky, and I have a colleague and friend, Dr. Kevin Lum, who's a medical director at the Dean Ornish Program, so he asked me if I wanted to work there. And this is, right up my alley and interests, lifestyle medicine, so I really wanted to work there. Because in the emergency room, I see a lot of patients that I only see once, and I don't get to see them again. So this was an opportunity to have more continuity of care and to really get to know patients better. Who's read this book, Reversing Heart Disease? I want some people, yeah? You read it, Jack? So Dean Ornish wrote this book, Reversing Heart Disease, about some of the experiences he had in his program with helping patients reverse heart disease through lifestyle changes. This is a study done by Dean Ornish of how intensive lifestyle changes can help reverse heart disease. So there were 48 patients with coronary artery disease, and they followed these patients for 5 years. They were randomized to either, they had the control group and then also the lifestyle change group. So the control group was following a step 2 diet of the National Cholesterol Program of the American Heart Association, which allowed them to have 25% fat in their diet and exercise 3.5 times per week. And you might think 25% fat is still quite a lot, right? But I guess that's less than 40% fat, which is usually what people in the United States are eating, okay? So it's still less, so it's not as bad. But the Dean Ornish patients are only allowed to have 10% fat in their diet. They're eating a vegetarian diet, and we also have them exercise, also have stress management training. Patients are supposed to stop smoking, and also there's a group support component. So they found that coronary artery disease improved in the group, the Dean Ornish group. However, the control group's heart disease progressed, and they had 2 times as many cardiac events. So actually it's sort of surprising, because in this group, the control group, some of them were still actually on lipid medications. But in the study, the group with the lifestyle changes, they weren't taking any lipid medications. So you think that without these lipid medications, they might be doing worse. But that just goes to show that the lipid medications are not as effective as lifestyle changes. So now I'm going to talk about the different components of the program at the Ornish downtown. So we have exercise, and this is the section that I'm involved in. we monitor the patients when they're exercising to make sure they're safe and that they don't have any irregular rhythms of the heart, so that every patient feels safe with exercising. There's an exercise physiologist there, and she caters the exercise program to each patient. And if the patient prefers to go on the bike rather than the treadmill, then she changes it to their preference. And there's also some weight training in the program as well. Then we have a meditation or yoga component, and we have some stress management specialists that teach patients how to meditate, and also we do some gentle yoga for the patients. Then there's a group therapy section. A lot of patients are sort of hesitant about this because they have to reveal their feelings, but in the end, they sort of enjoy it a lot, and it helps the group bond. And most of the groups, if not all the groups, are in touch with each other after the program, and they continue to have potlucks together or exercise together. It's actually really quite nice. And then the last component, of course, is the plant-based diet. So in the Dean Ornish program, it's a vegetarian diet. However, they do allow some non-fat dairy and also egg whites, but no, not the total egg, not the yolk, just the whites. So the program only allows 10% fat, which is actually quite hard, because if you look at most of the labels, most things are not below 3 grams of fat. So the patients have to buy things that are below 3 grams of fat per serving. It's actually quite hard. Even a lot of vegan things are not below 3 grams of fat, especially if they have a lot of nuts in them. So this is a study that I put in there because Dr. Esselstyn wanted to do a study because he thinks that maybe the plant-based diet is the most important factor out of all these lifestyle changes in reversing heart disease. So there were 198 patients with heart disease that they followed on a diet that eliminated dairy, fish, oil, and meat. This was a follow-up to a previous study that he did that you all probably saw on Forks and Knives. Did anyone see Forks and Knives? Yeah, right? So in that movie, they had some of the original people that he had followed all those years and that cured themselves of heart disease through dietary changes. So people were saying that sample size was too small. So then he did this follow-up study with a larger sample size. And so out of these 198 patients, 177 patients were able to remain adherent to the diet. So when people say that, these patients, they can't stick to the diet, they can't do these lifestyle changes, it's too hard. Actually, most people were able to do it. So only 21 patients were non-adherent, and those were the control group. And out of these patients that were adherent to the diet, only 0.6% of those who followed the diet had a major cardiac event, which is really wonderful. And 62% of those non-compliant who were non-adherent had adverse cardiac events. So I kind of see this in my daily practice because I see a lot of patients come in with heart disease, and we do our medical treatment, that's conventional medical therapy, which is putting these patients on high blood pressure medications, lipid controlling medications, maybe Plavix, like a blood thinner once they get a stent, and we do stents for people who have blockages in their arteries. But many times they come back and they have another heart attack or they have another blockage, and it's a continuous sort of slow deterioration until something really bad happens. So these patients, unfortunately, they don't improve on conventional medical therapy. Fortunately, in the program, we had a lot of patients improve. And one of the patients is here today. She's in the audience, and her name is Jana. Jana, you want to wave, or you're too embarrassed? Yeah. So Jana came last year to my lecture, and at that time we were announcing that the ʻEkahi Ornish Program was going to open, and she's had heart disease before, so she instantly wanted to sign up for the program, and she was one of our first enrollees. And so she talks about her experience in the program here.
How was your lab results before the program and after the program, and how did your blood pressure improve? Did you have other improvements?
My labs before the program were very scary, and after 9 weeks of following the Ornish program, my labs improved so much. My H1A1C?
Hemoglobin A1C,
Yeah. That fell or dropped 3 whole points, which in 9 weeks is really good. My blood pressure went from being high to being perfect. Cholesterol is perfect with no medication. And everything was just, everything improved. I can't tell you all the numbers, but even by that liver function test,
Oh, wonderful.
that improved. They always would tell me I had a fatty liver. Well, now it's not fatty no more. And all the other numbers improved wherever they are.
That's wonderful.
So congratulations to Jana. But she's still sticking with it. So Jana talked about how her hemoglobin A1C improved. Hemoglobin A1C is a measure of how your sugars are controlled within the last 3 months. So a lot of patients, they can have their sugar checked, and if they didn't eat, it might be okay, but you can't really cheat on your hemoglobin A1C because even you might be having cake every day, and then when you go in the doctor's office, you can maybe just not eat, and then your glucose is going to be okay. But the hemoglobin A1C tells people how compliant you've been with your diet, right? So this is a study done by Neil Barnard. And Neil Barnard, you guys know who Neil Barnard is, I'm sure. He's the head of the Physicians Committee for Responsible Medicine. So he did a study with 99 type 2 diabetics assigned to a low-fat vegan diet, or he put them on an American Diabetic Association diet. Has anyone ever tried to follow the American Diabetic Association diet before? I don't know, it's super complicated. This is I put this diagram up, you can't really see it that well, it's sort of small, but this is what they tell patients to do, and I can't even follow it myself, so I don't know how patients are going to be able to do it, They said 15 to 20% protein, which usually in their case means lean meat, like chicken or fish, and then 7% saturated fat, 60 to 70% carbohydrate and monounsaturated fats, and cholesterol of 200 milligrams per day maximum. I don't know how anyone's supposed to follow this diet. It's very, very complicated. I don't see there's going to be a lot of compliance, or patients might get confused and not do it right. So anyway, he put patients on this ADA diet, the American Diabetic Association diet, or he had them eat vegan, which I think is very simple. People can understand, don't eat animal products, right? So he found that more of the vegan group were able to reduce their diabetes medications than the ADA group. About 43% of the vegan group were able to reduce their diabetes medications compared to 26% of the ADA group. The hemoglobin A1C decreased more in the vegan group, about 0.96 percentage points more than the ADA group, was 0.56. So almost 2 times as many decrease. Also, the body weight decreased more in the vegan group than the ADA group. The vegans on average lost 6.5 kilograms, whereas the ADA group only lost 3.1. So they lost 2 times as much weight too. And this is right now it seems obvious because there was this recent study that came out that the vegan diet was best for weight loss, right? And so this seems like an obvious thing now, but this was a few years ago, so maybe not at that time. LDL cholesterol also fell more in the vegan group than the American Diabetic Association group. So, it's all these benefits. The American Diabetic Association diet is very, very difficult. Vegan diet is very easy, and you get so many more benefits. And also, the thing with the American Diabetic Association diet is they limit your portions. And in this study, Neil Barnard did not limit the portions of the vegan people. So they could eat as much as they want, just as long as it was in the confines of the vegan diet, So it's not complicated at all. I think it would be very easy for patients to follow. So, and then Neil Barnard says, the beef industry has contributed to more American deaths than all the wars of the century, all natural disasters, and all automobile accidents combined. If beef is your idea of real food for real people, you'd better live close to a real good hospital. So, anyway. So now I'm going to talk about fatty liver disease. Jana talked about how she was told she had a fatty liver. The liver usually has about 5 to 10% fat. And when you have more than this, that's considered a fatty liver. This is when you're not drinking alcohol, so non-alcoholic fatty liver disease. And I actually find lots of patients in the hospital have this, because I'll do an ultrasound on a patient because I think that they might have, gallbladder, gallstones, whatever problem, and then it comes back and it said, oh, the patient's, gallbladder is fine, but they have a fatty liver. I find so many patients have these days. It's very, very common. So this is how fatty liver disease happens. You have a normal liver that's well functioning, and then fat deposits cause a liver to enlarge. Then you get scar tissue developing, and the liver cells start to suffer. So you might get elevated liver function tests in this case, right? And then finally, you have liver cirrhosis. The scar tissue makes the liver hard and inflexible and reduces the liver function. So in the first two stages of fatty liver disease, this process is reversible. So you can reverse it with changes in your diet, right? But then once you get to the cirrhosis stage, it's no longer reversible. So these are some of the things you can do to get rid of your fatty liver disease. And what do we notice about this slide? So all these things are kind of caused by having a lot of saturated fat, which we talked about earlier in this lecture. Like high cholesterol, high triglyceride levels, obesity, type 2 diabetes. These are all problems with the metabolic syndrome. And that's what we have in the end here, the metabolic syndrome. So this is why Jana was able to improve her fatty liver, because she, in the Ornish program, ate less saturated fat. So that improved her liver function. And so if anyone out there, or you know anyone has fatty liver, you should tell them to try to make these changes. So the blonde lady says, I've decided to go on a juice fast. Dagwood says, I did that once when I was your age. The teenage daughter says, you did? Dagwood says, yep, instead of eating, I did nothing but drink apple juice. And then Dagwood says, yes, sir, that was the longest half hour of my life. So. All right, so now I have two other participants in the Ornish program, Myri and Mel. They're a couple, and Myri actually joined because Mel was recommended to join because he had heart disease by his doctor. So Myri was kind of surprised because she actually benefited a lot from the program, and she's going to talk about what kind of benefits she had.
The doctor told me that he's going to put Mel on this new program. I was excited to try something new to help Mel, but in fact, it helped me so much in the process, so I'm so happy that I did it with him. I had high cholesterol and my sugar was getting high. I tried to exercise more, but that didn't seem to help. I tried to eat less starch, but that didn't help. I tried 10 million supplements. So the weight gain made me have asthma. Maybe 10 years ago, I started to get asthma. I did have constipation, and I tried so many things, but nothing would help it. So finally, not having meat products in my life changed my digestion, and everything is normal now. I'm not so bloated. I finally found something that could help this problem. And I was able to reduce my weight by 11 pounds. And I went to my asthma doctor. He said my asthma was better. And I wasn't using my inhaler as much. So he said that meat is actually inflames your body. So going to this Ornish diet should be good for me, and it was.
So it's kind of interesting, right? So I mean, I really myself didn't know much about how not eating meat could help asthma, but actually it's very, very helpful for autoimmune diseases. Another thing she mentioned was constipation, which I dealt with a lot in the talk from last year. So she tried many diets and nothing was really helping her, but this really helped her lose 11 pounds in just 9 weeks, which is wonderful. And she actually also came off her cholesterol medication. That was her risk factor, which allowed her to join the program. She had high cholesterol, and she was able to come off her cholesterol medication. This is a study done where they put patients with asthma on a vegan diet. This was done in Sweden, actually. These are 35 asthma patients on long-term medication, and they had vegan food for a year. 24 patients were able to fulfill the treatment, because some patients couldn't do the vegan diet for a year. So in most cases, for these patients, the medication was withdrawn or drastically reduced due to significant decrease in their asthma symptoms. So they're suggesting in this study, the author said, if you fear the side effects of medication, you can replace your conventional regimen with actually just being on a plant-based diet, which is a great suggestion, I think. And I've had mothers come to me, they have children, and the children is having an asthma exacerbation. I try to give them prednisone. They say, I hate getting it. And we just don't have nothing to give them really, in terms of medication. And the mother's like, he's getting so fat because he's always on prednisone. So it's really a shame, because if you can prevent this with diet, your kid doesn't have to be on prednisone all the time. So why do you think asthma is helped by being on a vegan diet? You know, the animal products cause a lot of inflammation, and they think maybe because animal products have arachidonic acid, which leads to the formation of leukotrienes. This causes a kind of allergic reaction in the airways of asthmatics. They said also that vegetables like onions and garlics contain flavonoids, which have been shown to inhibit this inflammatory response. Also, they've found in childhood asthma, a diet rich in vitamin C can reduce wheezing significantly. So you can correct this vitamin C deficiency by eating fruits and vegetables, obviously. Everything that's orange has a lot of vitamin C, right? Like, you know, carrots, oranges, mangoes, and these are all found in vegetables and fruits. Can you guys read this one? All right. So this is another patient in our program. I think Jack knows him, right? Paul Bianfang. And he didn't want to have, he was a little shy, so he didn't want a video interview, so we just have an audio interview, but I wanted to put his picture up there so you guys can all identify him. And he's going to talk about how he was diagnosed with renal disease, how that made him feel, and his physician actually, I think, is John Hoke, and he suggested that he join the program to try to improve his health problems. So,
how did you feel when you got your creatinine specifically from your doctor? Did you think
the creatinine is a measure of your kidney function?
Did you think it would be reversible?
I was really devastated when I saw the spike in creatinine levels, indicating compromised kidney function. The number went to a level that was close to twice what a guy my age should have, and I was, like I say, I was devastated. I felt worse, but I went to a kidney specialist, told it was irreversible, and the best I could hope for was to suspend a progressive decline or slow it. Well, at the end of the 9-week program, my creatinine number had fallen to about 60% to normal levels, meaning essentially reversing irreversible kidney disease. And that was a huge deal for me, and it was achieved while enjoying a very tasty, entirely satisfied plant-based diet, and that big return came with absolutely no sense of dietary impoverishment whatsoever. That was a huge kicker for me.
Your creatinine, when you started the program, was it, you said 1.7?
Yes.
And then after, when you checked it again, it was 1.2?
1.1.
1.1, so it was back to normal. That's wonderful.
So Jack had an elevated creatinine, and his doctor basically, one of his doctors said that he would end up being on dialysis, which is terrible. I mean, does anyone have a relative or know somebody on dialysis? Yeah, I mean, it's 3 times a week. You can't really go anywhere unless you have dialysis set up where you're going to go. So it's really very hard lifestyle to have for somebody. It limits your freedom. And most people, I mean, a lot of people can't get transplants. I mean, usually they give them only to the younger patients. And even if you have a transplant, you have all these problems, like you have to be on immunosuppressive drugs, which, drugs that suppress your immune system, so then you can get a really bad infection. So, I mean, he was really happy to see that his creatinine was normal after the program. And we were really surprised because, I mean, I'd known that being on a plant-based diet can slow down the progression of renal disease, but I didn't really know that it could reverse it. So it's really a wonderful thing. And there's not a lot of stuff in the literature either. I did a search, and I found this one study which measured kidney function in a woman in the Nurses' Health Study and their dietary habits. And so the Nurses' Health Study is a very long study they've been doing since 1976. There's more than 100,000 US female nurses enrolled, ages 30 to 55 years, and they're mailing questions like questionnaires twice a year about lifestyle factors, and then they ask them about what kind of health problems they had. And also, in this case, they'd gotten some urine samples and some blood samples from the woman, so they could see how their kidney function was doing. So they noticed that a Western dietary program pattern, which in this case was eating a lot of red meat, sweets, processed food, was associated with a significantly increased odds of rapid kidney function decline compared to the DASH diet, which isn't even a completely vegan diet. It's a dietary approach to stop hypertension, which includes greater intake of veggies, fruits, and whole grains. So these people are probably still eating like chicken or fish or things considered like not as bad as red meat. So I'm thinking that, if you were on a completely vegan diet, you would have even better results, but they just don't have a lot of studies out there yet. So, but given that we have this experience in the Ornish Program, I think that, if you know anyone with renal disease, you should tell them that, you might be able to not be on dialysis, if you change your diet. So I think that'll be really great for some people. Who knows this person? So this is Jordan. She's one of our young members of Imagine a Vegan World. And she became vegan in high school, and she told me that she became vegan because she was the heaviest she was ever, and she wanted to improve her health. So she had an aunt living on a vegan farm, and the aunt was the healthiest person she knew. So she decided to go live on this vegan farm with her aunt and learn how to be vegan and cook vegan food. And so she went there to live with her aunt, and she was eating all the vegan food. It was really good for her. And then she came back one weekend to visit home, and she talks about her experience here.
I went back home to Illinois for a weekend, and I ate pizza, and the next day I couldn't close my fist, and my hands hurt really bad, and I think that was the point where I realized that I had arthritis, and it was something that was really, really bad for a couple of years, and eating the cheese, I think, made it inflame. And
So you hadn't realized before that the dairy products were causing your arthritis to become worse.
Yeah, no, like
Until you went vegan and
right,
just cheated on cheese for like a little bit.
Yeah. Yeah, I mean, my mom has really bad hand arthritis. My grandma has really bad hand arthritis, and that's how I knew it was arthritis. I mean, I couldn't make a fist. Like, it hurt to make a fist, and my whole hand, I just had to massage my hand. It hurt really bad.
And that's basically what made you decide to never go back.
Yeah. Yeah.
So this is a little, I don't, you guys probably can't read this. So there's an apple, and it's saying, hey, do you think we could hang out today, maybe catch a movie or something? And the guy who's walking out the door says, dude, I'd love to, but I'm hanging out with the other bros today. We'll hang out soon, though, I promise. So there's like a cupcake, a pizza, and some other grilled cheese or something. Yeah. So I'm going to talk a little bit about arthritis now. And first I'm going to touch on osteoarthritis, which is what most people have. And this is a kind of degradation of the cartilage. So the bone is rubbing on bone, and it causes the pain like that. This is a study done, 6-week study of patients aged 19 to 70 with osteoarthritis. And there were 37 patients, 18 control, and 19 intervention. And they were either on a whole food plant-based diet, or they're just normal control diet, which is probably the standard American diet. The whole foods plant-based diet patients had a significantly greater improvement than the control group in energy and physical functioning. And we talked about arachidonic acid before, and they're saying that because Western diets are high in arachidonic acids and it's very inflammatory, whereas whole food plant-based diets are low in arachidonic acids, this is what's causing the inflammation of the joint and everything. Another thing that Jordan sort of talked about, but I didn't include the clip, she had an improvement in her skin too when she became vegan, which was an extra bonus of all the, she lost 50 pounds. It was really an amazing transformation for her. Did anyone ever find that after they went vegan that their skin improved? Yeah, right? Always our hands, right? So reason is because we think that milk products are causing people to have acne a lot of times because of the hormones in the milk. So this is another study done, this Nurses' Health Study number 2 though, which was established in 1989 with more than 100,000 female nurses between the ages of 25 to 42 years old. And this is a very large study. 47,000 women completed questionnaires about their high school diet and acne. whether they had it or not, I guess. So they found that an intake of milk during adolescence was associated with a history of teenage acne. And this association was actually more marked for skim milk than other forms of milk, which is kind of surprising because some people might say, oh, it's because of the saturated fat in whole milk or 2% milk, and that's why, you're eating this fat and that's why you get the acne, right? Because it's oil or whatever. But actually, there was more of an association with the skim milk. Also, they found that there was an association with cottage cheese, cream cheese, instant breakfast drinks that have dairy, and sherbet. So they're thinking that the hormones in milk are increasing the risk for acne in this case. Just interestingly, milk also has been associated with increased plasma insulin growth factor 1 levels. That may also cause acne in addition to a lot of bad stuff like tumor growth. So. Next I'm going to talk about gout. Does anyone have gout? Come on, people. Nobody has gout? Yeah, so you got gout, right? So what is gout? Does anyone know what gout is? Okay, what's gout? Go ahead. Yeah, so uric acid, they have too much uric acid, and so it's accumulating in their joints and it's causing a lot of pain. So there could be several reasons that people have too much uric acid, and this is a little diagram showing your normal concentration of uric acid is anywhere between 3 to 7 milligrams per deciliter. However, when you have too much production of the uric acid, or you have not enough excretion, or you can't get rid of it enough, that's when you accumulate it and it ends up in your joints. How you get the uric acid in the first place is a lot of times through your diet by eating things that are rich in purine. So that's why it has a dietary purine load that contributes to your uric acid level, because purine breaks down into uric acid. Some people also synthesize a lot of purine. In the case of these, these Atkins, kind of like Atkins or these low-carb diets, this can actually exacerbate gout. So you should tell people who try to go on these low-carb diets to try to lose weight that if they have gout, it could exacerbate it, because what happens is that the purine in your body starts to break down because there's no carbs, and so it's breaking down the purines, like your body fat or whatever, and then it breaks down into uric acid, and so that's actually making the gout worse. So they're recommending these cases that these people eat more carbs so they don't get these gouty attacks while they're on this diet, right? So this is just a depiction of how gout works. These uric acid crystals, they're really painful, they accumulate in the joints and cause the redness, swelling, inflammation. This is a case of really bad gout. I actually haven't seen anyone with this bad gout, but I've seen someone with very similar gout who insisted on, continuing his diet the way it was. It looked very, very painful. And his wife and him actually got in an argument because the wife was like, you got to change what you eat. Look what the doctor says, and he didn't want to. So that was not a pretty scene.
This is Ray. He's going to take us hiking today. Now we're going to ask Ray a few questions about gout. What's it like to have gout?
It's painful. It's the worst pain I have experienced.
So where did you get your pain? And
My left toe.
Mm-hmm.
And it's so painful that even my bedsheet, just the touch of my bedsheet alone is painful.
Yeah, I'm sure. How does gout prevent you from doing your normal activities?
You can't walk, barely can walk, so you can't run, I can't hike.
Oh, that stinks.
It's horrible.
What is it like when you eat meat and you have gout?
Oh, once you eat too much, next morning you probably would not be able to walk. Or sometimes you have a tingling sensation. That's the minimum you can get.
How did you change your diet to improve your gout?
Oh, I experimented first. I tried to read about it, and I read about uric acid, and it comes usually from meat, so I just stopped eating meat for a while, and it goes away.
Great! That's good to hear.
So we have some pictures of Ray hiking. I don't know if you can see it because it's kind of far, but it's Ray and me. We took the shots with a drone, so it's pretty cool. So Ray doesn't have any problems with gout anymore, as you can see. All right. So Ray's actually here. Give a wave. So the average daily diet of the adult in the United States contains approximately 600 to 1,000 milligrams of purine, which then breaks down into uric acid. In the case of very severe advanced gout, dietitians recommend people only take between 100 and 150 milligrams. So I'm going to kind of show you in the next slides how much purine or uric acid is in different amounts of food. And you can kind of see like why Ray improving his diet helped his gout so much. So we have meats here. As we can see, I kind of put a red on all those things that have uric acid. It's super small, I guess, huh? That have, all the things in red have more than 150 milligrams of uric acid. So you kind of see they're sort of high in uric acid. So you see in the meat slide, almost everything is red. Fish too, a lot of red stuff. Poultry, you still really can't eat that, a lot of red stuff. Alcohol, beer is really bad. Stay away from beer, but actually you can drink wine. Dairy is not really a problem. Beans, nuts, and seeds. You do have to be careful with soybeans if you have gout, or peanuts. Mushrooms, cereals, noodles, generally okay. Fruits and vegetables, that's where it's at. Everything is very, very low in uric acid and purines. So this is just from the Mayo Clinic. They have a lot of stuff online for patients, and I just took this quote from their website suggesting to patients that studies have shown that vegetables high in purines do not increase the risk of gout or recurrent gout attacks. So a healthy diet based on lots of fruits and vegetables can include high purine vegetables. And these high purine vegetables are not anywhere as high purine as the meat products though. So you can also eat beans and lentils, which are moderately high in proteins, purines, but also a good source of protein if you're concerned about getting enough protein. We have a slide here. I'll read this to you because you probably can't see it. So this guy says, look at these groceries: kale, quinoa, acai berry, flaxseed oil, whole grain bread, and various other fruits and vegetables. I can't believe I grabbed the wrong bag. The lady in the yoga pants probably will pass out when she sees how much brownie mixes you bought. All right, so lastly I'm going to talk about rheumatoid arthritis. Does anyone have rheumatoid arthritis? Or know anybody with rheumatoid arthritis? There you go. Do you guys control it with your diet, or what are you doing for yourself? Dietary changes? Yeah, so I think dietary changes are really, really effective for rheumatoid arthritis. So rheumatoid arthritis, does anyone know it's an autoimmune disease? So your body's immune system is trying to protect its own health by attacking foreign substances, but unfortunately it mistakes substances in your joint for some bad thing, and then it starts attacking your joint. So you get a lot of inflammation in your joint. So this is a picture of a normal joint with synovial fluid, and then you have the osteoarthritis where the bone is rubbing on the bone, and then you have rheumatoid arthritis where the joints are inflamed from these immune complexes. These are the different stages of rheumatoid arthritis. So in early rheumatoid arthritis, you can't really tell the person has it. But then in the intermediate, you start to see that there's some changes. You know, the joints are a little bit bigger. You know, you see the finger joints are a little bit big. Kind of, you know, there's an obvious change. And then in late rheumatoid arthritis, you see there's this ulnar deviation of the fingers, or you see these fingers are kind of toward this way, this obvious deformity. And this is among some of the many other changes that people with rheumatoid arthritis get. This is a study done. A vegan diet free of gluten improves the signs and symptoms of rheumatoid arthritis. And this actually correlates with the reduction in antibodies to food antigens. So they had 66 patients with active rheumatoid who were randomized to a gluten-free vegan diet or a non-vegan diet. So 22 patients in the vegan group and 25 patients in the non-vegan group completed greater than 9 months of the diet. 40.5% in the vegan group improved compared to 4% in the non-vegan group. They found these diet responders had antibodies against this wheat protein and this milk protein. Their antibodies actually decreased. So they're thinking that, you know, because they were taking in less of them and they had this food sensitivity, that's why their rheumatoid arthritis improved. This is another study done where they put people on a vegetarian diet. There were 53 rheumatoid arthritis patients, 27 intervention, and 26 control patients. The patients who were put on the diet, they were fasting for 7 to 10 days first, then they were consuming a gluten-free vegan diet for 3.5 months. And after that, they were allowed to progress to a lacto-vegetarian diet, which is a diet that's vegetarian, so you eat, milk and dairy products too. So these patients, they were introduced to only one new food item every second day. And if they did develop a problem to it, like increased pain, joint swelling, or stiffness, they were told to stop it, and then they would not be introduced to that product again for 7 days. And then if they still had a reaction, then they would not give it to them the rest of the study. So actually some patients probably didn't get the dairy in the end and didn't really become lacto if they were found to have a sensitivity to it. So 12 out of 27 patients in the experiment diet group showed significant clinical improvement compared to only 2 of the 26 patients in the control group. So they're thinking that dietary changes alter the fecal flora and the amount and type of bacteria absorbed by the intestinal mucosa, decreasing the inflammatory process in the joints. There's one theory about rheumatoid arthritis that it's caused by this organism or bacteria called Proteus, which is a normal bacteria in your gut flora. That causes, sometimes if it gets overgrown though, it can cause like urinary tract infections. So they think that in patients with rheumatoid arthritis, they have this, they're having this in their gut, and then what happens is the antibody, or this immune system, goes after the Proteus, and that causes the rheumatoid arthritis and the swelling, the joints and everything, because they found that a lot of these patients with rheumatoid have this like antibody against Proteus. So the change to a vegetarian diet significantly decreased this antibody against this Proteus organism. So that's like one of the theories of how rheumatoid arthritis starts. And this is Shelley Gardner. She has rheumatoid arthritis, and she actually is really inspiring because she changed her diet and lifestyle, and you can't even tell she has it, because if you look at her joints in this video, you can't even tell. She practices yoga all the time. She jumps on the trampoline. She's just amazing.
I have read several books. The first one that really caught my attention was the China study, talking about the plant-based diet. So I really cut back on processed and meat and just gone to kind of clean, simple, plant-based, pretty much fruits and vegetables, more on the vegetables than the fruits, and legumes and whole grains. Where my wrists were extremely tight, my hands were swollen, and so when I would get down on the floor and do some of the poses, I could not get my hands underneath my body at all, much less be able to lift the leg or anything like that, because it hurts so bad. And now it actually feels really good to be able to do these poses and feel the blood circulating, and I'm so much more limber than I ever was. When I first started to exercise after I was diagnosed, it was very, very painful, and I felt like I shouldn't exercise because maybe that was doing more damage. And then once I realized what it was that I had, I knew I needed to exercise, and how I did that was just slowly but surely. It definitely takes time when you're hurting so badly to get past that stage. You just have to be patient with yourself and know that every day you make a little tiny bit of progress, and that's good enough. Consistency is key with anything, with our diet, with our exercise. If I go on vacation or something and I don't practice, if I don't exercise, and it's a week, I feel it that next week. It's been a long time since I've had a flare, many, many months. But when I did have them, I was not paying attention to my diet. And I kind of would get out of practice and start eating not just sweet. I'd add in a little bit more meat, or I'd add in the fat, let it come in one bite at a time, and pretty soon you're having a whole meal of junk. And so if I'm careful, mostly with my diet, but then adding in the rest and the exercise, I haven't had a flare, and I don't plan to have one because I'm more disciplined now than I have been probably ever in my life. I have lots of family and friends who are on medication, and they've kind of resigned themselves to the fact that that's just the way it is. And they don't want to take the time and learn about eating healthy and exercise. It's not worth their time. While it's a challenge to make the change in lifestyle, it's so worth it. You feel better, you have more energy. It is a challenge. It's hard sometimes, but it's an opportunity and a blessing. And in the end, you hopefully will live longer, but definitely if you don't live longer, you're going to live happier and healthier. And I just believe it's worth every effort that you make to eat healthier, to be healthier.
So she's really inspiring, yeah. So yeah, I wanted to kind of end with that. Just to say that, people think that they have a fate, and if they have high blood pressure or a family history of heart disease or a family history of cancer, or they have rheumatoid arthritis, that they have no choice, they have to be on these terrible medications and kind of live this really sad life. But it's not that way at all. You actually can change your diet, change your lifestyle, and really improve the quality of your life. And that's why I think plant-based diet can cause a lot of miracles for people to happen, and things that you didn't even know that it could bring about. So I just want to say you should eat as many vegetables as you can, eat the rainbow. And I'm going to end with a few words from Mel, Myri's husband, and about his experience, because lots of people say, well, it's really hard, I don't think I could go vegetarian, but he talks about it. And I like him.
I'm used to eating a lot of bad foods, like a lot of meat, a lot of seafood, spam, whatever you can think of, I was eating. I thought it would be really a hard transition for me to go from being strictly meat eater to going vegetarian. And I found that, after several weeks in the program, it wasn't that difficult, and I didn't really miss the meat and the seafood that I usually eat. I didn't think I would ever be a vegetarian. I thought these people were just different from us, but now I can see the advantages of going vegetarian and cutting out most of the meat product. I see it in the results that I have after 9 weeks. So, and it looks very promising for me. And because I had a heart attack, I think I need to really stick to it. So.
Yeah. So just, this is my contact information. If anyone has any questions, gracefulliving365@gmail.com. And you can check out my blog, graceinhawaii.com. And for fun videos, inspiring people, check out my YouTube channel too.
Thank you all for coming. Mahalo. Have a safe return home tonight.
This program is brought to you by the Vegetarian Society of Hawaii, a nonprofit organization dedicated to sharing with the community the many benefits of a vegetarian diet. Free monthly meetings include vegetarian experts found locally and on the mainland, quick and easy cooking demonstrations, and healthful and delicious food samples. Members enjoy an informative quarterly newsletter, social activities, and discounts at many vegetarian-friendly restaurants and health food stores. Visit our website at www.vsh.org. vsh.org.